half the community followed him and half the community resisted that change.
Could you describe the operation here in Bella Coola that United Church Health Services is running?
So in Bella Coola we have a 15-bed hospital and a physician clinic, pharmacy, and we have community mental health and public health programming. Serves a population of about 5,000 people.
If we just go by the numbers, you've got a lot of work to do here.
Our expected life here in the Central Coast is 68 years compared to 80 years in the rest of the province. Our injury-caused death is 2 to 3 times over that of the provincial average. Some staggering differences in our health.
Michelle, this is a beautiful little hospital. Tell me a bit about what kinds of services are available. What do you have to expect to do to serve this population?
We actually have a lot of services for a small place. We have the acute side of things, and we're very fortunate to still offer obstetrical services to the community. For a small town like us, we're very lucky on that one. But we have mental health program, community, long-term care, home support, that sort of thing. Public preventive health program, physiotherapy. For a facility this size, we have quite a large physiotherapy.
So ER too, right?
Oh yeah, ER.
Comes
definitely,
in through this door right here.
That's why we're here.
Here. So let's walk down this hallway here.
Yeah.
So how many staff here?
We have about 61 total staff, and we have about 35 full-time, part-time staff.
And how many physicians? I mean, I know they're not the only people that count, but
That's
how many
right.
physicians?
We have 3 full-time physicians and 2 share.
So they must have to be able to deal with just about anything.
Yes, they do. They deal with anything that comes through the door.
Now, how tough is it to find people to do this kind of work?
We're finding it a real challenge right now for recruitment, for nursing staff. That's what I have to look at with our Director of Patient Care. Nursing staff, the professional staff, the diagnostic staff, extremely hard to attract them to a place like Bella Coola.
Does the link with the United Church help at all? I mean, we sometimes see the ads in the United Church Observer for these hospitals, and does that link help?
Well, it is our feeling that it does. One of the ladies that we just had in here doing an LPN rotation for us works in Victoria. She said, we're working under the same contracts, the same restrictions, the same everything. But she said, you're doing things way differently in Bella Coola than we are. We believe it's because we're a faith-based organization, that there's an underlying sense of something here that you can't put your finger on, but it does make a difference.
If United Church Health Services is going to be in the health business, then it needs to be looking at the whole health of the whole person. If we were just going to stay focused on the physical health or the acute care side, there'd really be no reason for us to be involved. But what we're looking at is the health of the individual holistically, so we'll be looking at mind, body, spirit, as well as the physical person. And it fits in very nicely with the communities we're in. In the Central Coast, we're about 2/3 First Nations population, and their traditional beliefs of health are very holistic. Certainly spiritual and social health are there top on the list. If we don't deal with the self-esteem, the mental, social, spiritual health, we're never going to address the physical health.
When the church decided to